Jeremy Clarkson had his first gig with the BBC at the age of 12, lending his voice to the radio adaptation of the Jennings novel series. This was a sign for things to come, as the 61-year-old has been in the spotlight in one way or another ever since. Famed for presenting Top Gear, he's now the game show host for ITV's Who Wants to Be a Millionaire, and he has his own show, Clarkson's Farm, documenting his attempt to run a 1,000-acre farm with his girlfriend Lisa Hogan. The actress, known for her part in the 1997 film Fierce Creatures, which also starred Jamie Lee Curtis, spoke about Jeremy's petrifying illness. "Jeremy getting COVID was petrifying," she said on Clarkson's Farm. "But it was, thankfully, a very light dose. Everyone thought at the time that if you got it, you'd end up in a hospital, so we were very aware of that." Posting on Twitter, Jeremy asked, "Does anyone know someone who presently doesn't have the bat flu?" Referencing the coronavirus on July 8, Jeremy continued, "I know almost no one who hasn't had it, and many who now have it again." Coronavirus Johns Hopkins Medicines explained SARS-CoV-2 is a type of coronavirus that caused the global pandemic we're currently facing. The disease has caused millions of deaths around the world. It has also caused lasting health problems in some people who have survived the illness. Spread through droplets, the virus is released into the air when an infected person breathes, talks, laughs, sings, coughs, or sneezes. The infectious particles can linger in the air and accumulate in indoor spaces, especially those that are poorly ventilated. This is why mask wearing, hand hygiene and physical distancing are essential to preventing COVID-19, said Johns Hopkins Medicine. In the UK, COVID cases are drastically increasing, with 261,832 people testing positive for the virus in the past week. CoV-2 may have originated in an animal and mutated so it could cause illness in humans. In the past, several infectious disease outbreaks have been traced to viruses originating in animals, including bats. Symptoms of coronavirus can appear within 2 to 14 days after exposure to the virus. However, a person can be infectious 2 days before symptoms appear, and can continue to be infectious for up to 20 days after symptoms show up. A person's infectivity depends on their immune system and the severity of the illness. Some people may not have any symptoms of coronavirus, even though they're infectious. This is known as being asymptomatic. The best way to keep on top of coronavirus infections is to take 2 weekly rapid flow tests, available for free from the NHS. If you do have any symptoms of coronavirus, you can request a PCR test from the NHS. You are recommended to self-isolate from the moment symptoms appear until you get a negative COVID test result.